name is Jaden Gillum. Today I will be performing the skill of a NG2 placement. I would knock on the door, introduce myself to the patient, practice all GSP guidelines. I would make sure to do my correct assessments. I would assess for allergies. I would identify my patient using 2 patient identifiers. I would follow the 11 rights. I would perform hand hygiene. I would explain the procedure to the patient. I would raise the head of the bed up to a good working position. Then the next thing I would do is take my 10-inch double lumen and measure it from the nose to the ear to the sphenoid process. Then what I'm going to do is take my marker or tape and mark it. Okay. Once it's marked, I'm going to clean my hands again, don clean gloves. And then I'm going to take my lubrication and lubricate the end of my NG tube. Then I'm going to have my patient tilt their head back, flex it back, insert into the nostril, pushing until I see the back of the throat where the pharynx is. And then I would have them tilt their head forward, chin to chest, instructing them to swallow as I push in. All the while assessing my patient for any choking, any signs of distress. I would immediately stop the procedure. Swallow, 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 in until I hit my mark. Once I hit my mark, I will stop, grab my tape. I would loosely secure it to my patient. Once it's secure, I would call and have a confirmation of placement by an x-ray. Once it's confirmed by x-ray, I can confirm it using pH, gastric content from the stomach. I would make sure to have my test strip ready and in my Emerson basin. Then I'm going to take my syringe, pull back 5 to 10 cc's of gastric content, assessing that it's the correct color, making sure. Okay, and then I'm gonna test on my strip. Okay, making sure the reading's correct. It is. Then I'm going to securely, I'm going to measure the outside from the tip to bottom. Okay, 43.5. Once it's measured, I can securely tape it to my patient. Okay. I'm going to tape it to my patient's nose. Making sure not to obstruct their airway. Okay, once it's taped, okay, now I'm going to turn my wall suction on to low intermittent. Okay, I'm going to test that it's working. Okay, now I'm going to attach the wall section to my lumen. Once that's going, I'm going to securely attach it to my patient using whatever appropriate material the hospital uses. Okay, making sure to tape it above the stomach because of the type of NG tube it is. Again, I'm going to remove my gloves, perform hand hygiene. I'm going to document and record.